that opponents of Medicare for All have really, they're the only tactic they have is to scare seniors that they have something to lose. So it's really important to understand and to communicate to everyone who is currently on Medicare that they should be the strongest supporters of Medicare for All. They have an enormous amount to gain. Medicare is extremely popular. It's been extremely, it was enacted in 1965. It's been very popular program. And I think what it's important to emphasize is that Medicare for All will improve current Medicare for current beneficiaries and then extend it to everyone. And it can improve it because of the efficiencies that are gained by covering everyone and having a universal single risk pool. So let me start by the way that it's improved. Long-term care, we don't really have a solution to long-term care these days. Medicaid has become the default program for Medicaid. It was not intended to serve this purpose. It's supposed to be for low income. But what seniors and their families find is that they really have to impoverish themselves when they need long-term care. Long-term care can cost, it costs on average about $225 a day, or $82,125 each and every year. Very few people are wealthy enough to be able to afford that on their own. But the Medicare for All Act of 2019 covers both in-home care and institutional nursing home care, which is huge. It's something, those are costs as we have an aging population that are going to grow. Most people want to age in place if they can. We want to have the right incentives so they can do that and the right supports. And Medicare for All has that, and it also extends that to institutional care. So that in and of itself is huge. It can provide all of this and still save seniors money. Social Security has very modest but vital benefits. But because healthcare costs keep going up, which means Medicare premiums go up, out-of-pocket costs go up, more and more of Social Security dollars are going to Medicare, which means an indirect cut to Social Security. On average, about 40% of Social Security beneficiaries' Social Security benefits have to go out in prescription drugs, for healthcare, and for premiums, copays, deductibles, and so forth. What the Medicare for All Act does is free seniors from all of those expenses. It's basically a boost in their Social Security benefits because they don't have these big expenses. The costs are spread across the population. Another big advantage of Medicare for All is that there are no networks. So you have complete choice about what doctors to go to, what hospitals to go to, what referrals to have, what specialists when you're in need of a specialist. You know, a lot of opponents of Medicare for All go, oh my gosh, people lose choice. It'll be exactly the opposite. Seniors and everyone else will have much greater choice because we won't have these in-network, out-of-network issues that we have now. Everyone will be in-network. In addition, the Medicare now has some gaps. It does not cover vision, hearing, dental. These are extremely important services. Hearing in particular can lead to falls and vision as well. They can create all kinds of medical problems. Dental problems can really result in malnutrition and serious other health ailments. So these are all extremely important benefits, which we don't have under Medicare for one simple reason, and that is that we pay overall for our health care about twice in terms of percentage of GDP of every other industrialized country. And of course, we don't cover all our citizens the way they do, we have less good health outcomes. And the reason is that insurance is most efficient and effective when you have the highest risk pool possible. And it's only the federal government that can require everybody be in a single risk pool and can have none of what's called adverse selection, where people can, could wait until they're sick and then opt in. Obviously, that is a very expensive way to run healthcare insurance. With Medicare for All, where everyone's in a single risk pool, it is very efficient, and we will gain the kinds of savings that other countries have. A lot of opponents of Social Security, of Medicare for All say, and they're often opponents of Social Security as well, so it's a little slip there. But a lot of them say, oh my gosh, this is gonna raise your taxes. How much is this gonna cost? I think the right question to ask is, how do we divvy up the savings? This is gonna cost so much less for Americans out of pocket that the real question is, how much does business save? How much do individuals save? And so forth. So as I say, it's very easy to scare seniors and people with disabilities, who are the current Medicare population, are the ones who have the largest, on average, healthcare costs. Healthcare is very frightening to people because you want to make sure that if you have a life-threatening illness or accident, you can get the care that you need. Many people are hanging on until their 65th birthdays when they can get Medicare. And once they're on Medicare, it's very easy for demagogues like Donald Trump to scare them and say, oh my God, they're going to dilute it and weaken it. And I think the important message is that it will gain strength in a number of ways. First of all, it will be much more cost efficient, which will lower their seniors' out-of-pocket costs. It will also extend the benefits that seniors get, including the invaluable benefit of long-term care. So it really is a winning formula. And the other thing is that once you have Medicare and Social Security are very politically strong, because you've got 63 million people receiving Social Security benefits every month, their families and so forth, and you have similar numbers of people receiving Medicare. And politicians know that they tamper with that at their risk. So just imagine if all of us were in one system, that would create even more political strength. So let me conclude with a point about history, and that is that Medicare was always intended to be simply the first step towards Medicare for All. In 1935, President Roosevelt almost proposed universal health insurance guaranteed at that time, and decided to wait because it was such a big lift, along with Social Security and unemployment insurance and so forth. He was going to pursue it in the early 1940s, but then we entered World War II. He then died, and President Truman picked up the mantle and tried to push it then. And they were unable to get it through, so they decided to try to do it incrementally. So we started with Medicare in 1965 for seniors. Medicare for people with disabilities was added in 1972. The thought was we would add a MediKids program, Medicare for children, soon after that, and gradually cover the entire population. Unfortunately, we had the Reagan Revolution and the conservatives that saw government as the problem rather than the solution, and we got off track. But I think this is a moment in history when we are getting back on track. And my own view is that seniors should be really leading the way, because seniors know better than anyone how valuable Medicare is and how important it would be for it to be, it would be valuable for them, it would be valuable for their children, for their grandchildren, and for future generations. So part of this fight is to enlist seniors and get them at the forefront of of fighting for Medicare for all. Thank you.